Because some strains of tuberculosis are becoming resistant to drugs, some doctors now prefer to add chemotherapy to their treatment regimen for tuberculosis. Even this has many side effects, which are now well known. To the doctor's prescriptions, traditional medicines and alternative medicine protocol may be used as adjunct to conventional treatment or for prophylactic prevention purposes. The recipes, which I will mention hereafter, have been used by some orthodox doctors either alone or as adjunct medication, with successful result. They have been found useful, also, in other pulmonary, lung, or breathing problems such as asthma, congestive obstructive pulmonary disease (COPD), and emphysema, to mention a few of them. The therapeutic goals in employing them revolve around, as usual, detoxification, alkalization, mineralization, oxygenation, parasite killing and immune boosting, among other objectives. An acidic system weakens the immune system and disorient it, whereas an alkaline system does the opposite. There are herbs, which stimulates the excretory organs, the lungs, liver, kidneys, skin and the bowels, to empty their toxic wastes for evacuation, and there are antioxidant herbs, which destroy free radicals in the toxins, to prevent their overload in the blood during detoxification from mauling the system. Antioxidant herbs for treating tuberculosis. Astragalus. I would like to begin with Astragalus, which has demonstrated the capacity to help the body produce more macrophages. Zinc is useful in more than 250 ways for equilibrium the body biochemical processes. Women know it is good for hair, skin and nails, robust breasts, fertility and all that. Many men, too, have found it helpful to combat prostate gland challenges and improve sperm count and sperm health. Without zinc, there is little vitamin A can do for healthy vision. In its immune system function, zinc helps the thymus gland to maintain its size and efficiency. It is inside this gland that T cells or fighter cells mature. It is like their finishing defense academy. Golden seal root. I doff my heart for golden seal root, one of nature's most dependable antibiotic, antiviral and antifungal herbs. Calamus root, yarrow tea and horsetail herbs. Maria Trebin, that great Austrian herbalist of blessed memory, eulogized Calamus root for practically all health needs, including tuberculosis in her Health Through God's Pharmacy. Mark Trebin says, a year ago, a man 1.8 meters tall in his late 50s had become a skeleton without knowing the reason for his illness. Weighing only 45 kilos, he in company of a nurse stepped into the surgery of his doctor, who was telephoning another doctor, and heard, "I am sending you my most hopeless patient, cancer of the lungs." So unwittingly the man learnt the diagnosis of his illness. Afterwards, someone advised him to chew calamus root to break his smoking habit and to drink yarrow tea mornings and evenings. Slowly, his weight increased, and since he felt better, he did not return to the doctor. About half a year later, he again went to the surgery of the doctor, who was most taken aback since he had thought this man dead. "What did you do?" was all he could say. "Chewed calamus root and drank yarrow tea," replied the man. "Calamus root? Where did you find them?" "They are sold in herbal shops for a few shillings." The man at this time reached his normal weight of 86 kilos, and it was half a year later that he undertook a mountain hike, carrying a full laden backpack when I met him. The book, which I recommend for your health library, tells, also, the story of a man aged 36 years, who literally lost his balance after surgery to free the liver of a tumor. He was thin and went to develop tuberculosis in the intestine. Calamus root helped these conditions as well, reported Maria Trebin. There are other startling cures achieved in the stomach and intestinal disturbances, including cancers. To calamus and yarrow we may add her suggestion of horsetail. I guess this is because of the high silica content of this herb. Silica, called the homeopathic surgeon because it breaks up growths, is now available in 100% biochemist tissue or cell salt number 12 and 96% in diatomaceous earth or diatom. Stinging nettle has small amount of it. Grape seed extract. Dr. Robert Atkins, one of those conventional doctors, who made the United States adopt nutritional food supplements. I would quickly like to add to the list grape seed extract (GSE), which is highly antioxidant and one of those few supplement substances, which easily cross through brain-blood barrier. Dr. Raymond Strand reports that a man, who declined chemotherapy and opted instead for dietary supplements, especially GSE, normalize his antinuclear antibody ANA results within 1 year. His ANA had risen well over 1000% of normal. Dr. Strand mentioned this case in his "What Your Doctor Does Not Know About Nutrition May Be Killing You." Vitamin A. Let's hurry to Dr. Robert Atkins. Among his suggestions for all lung diseases is vitamin A, but like all doctors, this mega-dosage physicians will not touch regular, i.e. oil-soluble, vitamin A with a long pole. Not more than 5,000 IU of it every day is often suggested, to prevent liver discomfort or damage, and birth defects. Dr. Atkins, like many physicians, prefer the water-soluble variant of vitamin A, which is often mentioned in this column as solubilized or water-soluble vitamin A. Dr. Atkins calls it by its other name. Other herbal products suggested by Robert Atkins. Micellized vitamin A, saying, if your body's vitamin A stores must be replenished in a hurry, as would be necessary at the outset of an acute respiratory infection, use the micellized version, which bypasses the liver and is absorbed easily, thus reducing the likelihood of a toxic accumulation. Even in amounts of 100,000 IU a day, for months at a time, micellized vitamin A has never caused any documented side effect. This safety record does not mean, however, that therapeutic dosages need not be mentioned by a doctor. Micellized A performs impressively against sinus and other acute infections, especially when combined with micellized vitamin E. Dr. Atkins suggests carotenoids, not just beta-carotene, a mere member of the 600-member plus family, which is offered today for even cancer prevention and cure, except lung cancer caused by smoking, which at least one study has shown is worsened by it. It warns against synthetic beta-carotene in particular, saying it has been found to lower the blood presence of other carotenoids. One of such affected carotenoids is lutein, which is needed for healthy eyes and crucial in glaucoma management. He salutes natural beta-carotene, a deficiency of which he says has been linked to many cancers, including that of the lungs, and says it works best when it is combined with, say, micellized vitamin A and other natural carotenoids. Maria Trebin has an interesting handle on emphysema as well as cardiac asthma and disorders of the thyroid gland with their shortness of breath, and is caused largely through liver trouble. The upward pressure of the liver contributes to the swelling and enlargement of the bronchial tubes, lungs and the heart. The constant pressure on the sensitive thyroid gland causes abnormal changes. In such a case, 1 cup of common club moss tea is drank in the morning and Swedish bitters is applied as a compress for 4 hours during the day. I will round off with Dr. Atkins. The lungs and bronchial airways of the body are amazing, but delicate tissues. They are assaulted daily with both outdoor and indoor pollution, not to mention cigarette smoke and the toxic chemical found throughout our environment. Compound this inflammatory insult with lack of anti-inflammatory nutrients such as fish oil and antioxidants in our diets, and you will understand why asthma and other pulmonary problems are continually on the rise. Food allergies can also be involved. The bottom-line approach for inflammation of the bronchial passage is to relax them with magnesium, protect them with antioxidants and reduce their exposure to environmental insults. He suggests vitamin C, vitamin A, essential oils formula, N-acetylcysteine, magnesium, beta-carotene, quercetin, selenium, taurine, vitamin E and CoQ10. For more research-based natural home remedies, subscribe to this channel.